Hello everyone, my name is Tom and I'd like to welcome you to ADO's January webinar. And with it being Folic Acid Awareness Week, we've put together this presentation on the benefits of folic acid. Today's speaker is Clinical Assistant Professor from Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you again, Tom. Very happy to be here to talk about some folic acid. I hope everybody memorized that biochemical compound on the previous slide, so that we'll have a great in-depth detail on the biochemistry of folic acid going. But no, you don't have to have memorized that. We're going to talk in hopefully much simpler terms that you'll get a lot out of what folic acid does, what it can do, and what it shouldn't be used for. So here you have some folic acid pills. What is folic acid? Well, folic acid is also known as folate and is one of the essential B vitamins. In fact, it's a B9. There are 12 B vitamins that are numbered B1 through B12. You may have heard some of them are given different names, like B1 is also called thiamine. But today we're going to talk about folic acid or folate, which is B9. You can buy it as a separate vitamin in the health food store or vitamin section of your supermarket. It's also included when you see a B complex vitamin most of the time. It's in most multivitamins, and it is a particularly large component of many prenatal vitamins that are sold. However, most people don't actually need these B9 vitamins, and let's go on to the next slide. The vast majority of people get more than enough folic acid in their foods. Folic acid is in darn near everything. It's in citrus and citrus juices. It's in vegetables, like you see in the bottom left, and in particular, it's abundant in green leafy vegetables. It's in meat and animal products, like the steak you see on the bottom right. Now, the one thing that does not have a ton of folic acid in it is breads and grains. But never fear, because the government does not want people to be folic acid deficient for reasons that we'll discuss moving forward. Since 1998, the government has ordered that folic acid be added to all grain and bread products in the United States. So anytime you buy a loaf of bread or some muffins, rest assured it has been supplemented with folic acid. So it is very, very hard, looking at this slide, to eat anything in a normal American diet without getting enough folic acid. So what does folic acid do? Here you have some interesting pictures of DNA strands. DNA is the floor plans, if you will, for every living thing and for every cell in the human body. It encodes what we're supposed to be. It encodes whether we have blue eyes or brown eyes. It encodes whether we're supposed to be tall or short. And anytime your body replicates a cell, so anytime your body grows even a little bit, you have to make more cells. And every time you make a new cell, it needs a whole new, brand new copy of your body's entire DNA. Every single cell in your body, with the exception of red blood cells, has a full copy of your entire body's DNA inside of it. So as we grow, whether we grow out our fingernails or our hair, which we'll get to later, or some lining cells inside of your mouth because you bit your lip, or whether you heal a cut on your skin, every time cells grow, you are copying and replicating DNA. Folic acid is necessary, urgently necessary, for proper replication of DNA. Without enough folic acid, your cells won't divide right because their DNA won't be able to be copied correctly. Now, what is a time when we do a lot of cell growing, when there's a lot of duplication, when we need to grow a lot more and replicate a lot more DNA because of aggressive growth in the human body? And we'll see that on the next slide. Pregnancy, of course. You are growing a whole new person inside of your body. There is a ton of replicating of DNA. There is a ton of growing. And in fact, here you are not even growing your own per se DNA. You are growing DNA that is a mixture of half your DNA and half of your presumably partner's DNA. And all of those growing cells need folic acid. Because of this, it is very, very important for pregnant women to have enough folic acid. Even a normal amount of, quote unquote, enough folic acid is oftentimes not enough for pregnant women. So because of that, pregnant women need to take extra folic acid, and we include it in, again, just about every prenatal vitamin has supplemental folic acid, usually about 400 micrograms. We'll get back to that in a little while. Remember, 400 micrograms. Because pregnant women don't always know when they're going to become pregnant. A lot of people don't take their prenatal vitamins before they first get pregnant, before they first try and get pregnant. And a lot of the most important growth of a fetus takes place before a woman even misses her first period. So while it is very, very important for women to take their prenatal vitamins once they find they're going to become pregnant, and while many women start prenatal vitamins appropriately when they're even starting to try to become pregnant, that's why the government has done things like instill folic acid in our bread products, because they want to make sure if people become, I'll use the term, accidentally pregnant or unexpectedly pregnant, we've minimized the chance that they're not going to have enough folic acid in their system. So why is it so important for pregnant women and their unborn children to have enough folic acid? What is the most important part about folic acid to pregnant women? And we'll see that on the next slide. Your neurological system is the most susceptible to poor DNA copying. And because of that, newborn children are at risk of developing, this is called spina bifida, and I'll describe that in a minute, but complications of their central nervous system. In spina bifida, which is a type of neural tube defect, your body doesn't form your spine correctly. There's a hole in your spine where there should be spinal bones. And because of that, your spinal cord can literally push out through your back. It is something that is surgically correctable, but if it's bad enough, can lead to chronic problems with the legs. Even though it gets corrected shortly after birth, if the spine has received any trauma as a result of being pushed out through your back, you can have lifelong problems with weakness in your legs or even inability to walk if you suffered spina bifida. It has been shown that if women take 400 micrograms a day of folic acid, that there is somewhere between a 40 and 80% in reduction in neural tube defects like spina bifida among pregnant women. So obviously this is something that we would very much like to avoid, and because of that, we have really made a push towards making sure that pregnant women have enough folic acid. There are other birth defects that can be associated with insufficient folic acid in a pregnant woman, but this is the most common and the most dramatic by far. But folic acid is not only important for women, it's important for everybody to have at least a healthy amount of folic acid. One of the things that folic acid does is it helps our body produce red blood cells. In our body, our blood supply is completely redone every 90 days. A blood cell that is created in your bone marrow only lives for 90 days, and then it needs to be replaced. So our entire blood supply every 3 months gets completely killed off and regrown. Obviously, that means that your bone marrow has to be one of the more aggressively growing parts of your body. It is constantly growing new red blood cells. Now, even though I said that red blood cells are the one type of cell in your body that doesn't have DNA, the cells that are growing these red blood cells do have DNA and need for their DNA to be copied in order to make healthy red blood cells. Insufficient folic acid can lead to anemia. You don't get enough red blood cells. You can feel tired all the time or short of breath. And usually in patients with folic acid-related low red blood cells or anemia, the red blood cells are not only insufficient in number, but too large. That can be one sign that people have a folic acid deficiency, is if their blood cells, when measured at the lab, come back as anemic and overly sized. But there are even some less health serious, but still significant ways in which folic acid is important. Who wants gray hair? Nobody. Early graying can be a sign of folic acid deficiency. And unlike age-related graying of the hair, which this woman probably has, early graying of the hair as a result of folic acid deficiency is reversible. Remember I said earlier that hair is one of the areas that grows. Yes, hair is one of the things that keeps growing no matter how long you live. If you live to 100, you still got to get a haircut every now and again. You might not have as much hair. It might not be as thick and smooth and easy to comb, but it does keep growing in those hair follicles. And anytime you grow hair, you're replicating cells, you're replicating DNA, and you need folic acid. So if you find yourself graying early, well, maybe you just got bad genes and bad luck. But maybe you should get your folic acid level checked as well, and maybe it could be reversible. There are certain medicines that can actually deplete your folic acid level. And because of this, you need to take extra folic acid when you're taking these medications. One of the main ones you see here is called Methotrexate. Methotrexate is a medicine that we used to use for certain types of cancer, and we don't use it too much anymore for that, but it is very commonly used to treat certain autoimmune problems, particularly rheumatoid arthritis. One of its big side effects, however, is that it does deplete your body of folic acid. So when you take methotrexate, you need to take supplemental folic acid with it to make sure that you don't develop anemia or gray hair or have problems with cell replication like we were talking about. So we've gone through a lot of ways in which folic acid could be very, very helpful. It can protect us from certain medications. It can protect us from neural tube defects. If we're pregnant, it can keep our hair from going gray early. Why don't we just take a lot of extra folic acid? Why don't we put every person, especially young women, on lots of folic acid from the time they're 10 years old? I mean, the government's already forcing it into us with our grains anyway. Isn't that a great idea? And the answer is maybe not. So here you have a colonoscope, and I promise we're going to get back to the colonoscope in a minute. But I want to talk about the double-edged sword of folic acid. So about 15 years ago, there was a big push to do exactly what I said, which is give everyone large amounts of folic acid. Why was that? Well, number one, because if it does help cells to replicate, and it does protect pregnant women against having babies with neural tube defects, why not give it to everybody? And then we found something even more fascinating. In people with heart disease, they were found to have an extra high level of a chemical called homocysteine. Homocysteine is something that you may have even gotten your blood work checked for at some point in the past. And they found that patients with higher homocysteine were much more likely to have high levels of heart disease. And then a scientist discovered something fascinating. If you give a lot of folic acid, you can lower someone's homocysteine. It was thought briefly that we might have found a cure for heart disease. If we could just give people folic acid and lower their chance of having high homocysteine, then we could lower their chance of having heart disease, and we could prevent heart attacks. Unfortunately, it did not work out like we had hoped. In fact, we found that it was the heart disease causing the homocysteine, not the homocysteine causing the heart disease. Because of this, lowering the homocysteine did nothing other than hide the fact that the patient was developing heart disease and provided no benefit against heart attacks whatsoever. But in the process of studying that question, we did find some valuable information. You see, most of our body is not supposed to keep growing. Our colon's not supposed to get any longer. Our lungs are not supposed to get any bigger. We're not supposed to get any taller. We're supposed to grow in certain areas that are important, like we've talked about. Hair is supposed to grow, nails supposed to grow, skin's supposed to heal when you cut it. But generally speaking, most of our body is not supposed to continue growing past, adolescence. And if parts of your body grow when they're not supposed to grow, for that, it's unfortunately cancer. And we found that high levels of folic acid might be leading to excess replication of cells, excess DNA duplication, and in fact, excess cancer. In the studies that were being done for heart disease, patients were getting usually between 800 micrograms to 1,000 micrograms of folic acid every day. As you might recall, that's about double what we usually give to pregnant women nowadays. And in those studies, they found a 21% increase in cancer, a 38% increase in deaths due to cancer, and an 18% overall increased death rate. Among those increased cancers, they found a little bit of an increase in the risk of colorectal cancer, which is why I have the picture of the colonoscope there, because it's important to get your screening for colon cancer, especially if you take excess folic acid. They also found a 25% increase in lung cancer, and a large increase, the biggest increase, was in prostate cancer. Now, the funny thing about the prostate is one of those organs that keeps growing your whole life no matter what, much to men's chagrin. A lot of men, as they get older, as their prostate grows, they start to have problems with urinating. But the prostate keeps growing. Now, if men live long enough, everybody gets prostate cancer. That's a whole talk for a different day. But eventually, if a man lives long enough, pretty much every man will get prostate cancer. It's said that around 85% of men have prostate cancer, at least microscopically, by the time they're 85 years old. So if you put particularly men on a medicine that causes cells to duplicate faster, you can speed up prostate cancer, is what they found. So putting that all together, what we have found is that excess supplementation, not just the amount that you're going to get in some extra grains from the government putting folic acid in things to protect pregnant women, or having a little of extra citrus juice, but taking significant supplementation, 800 micrograms, a gram of folic acid every day, can potentially increase your risk of certain types of cancer. In fact, another disease that features a lot of cell replication is leukemia. In leukemia, those blood cells, remember we talked about those blood cells. We need our blood cells to replicate to make extra red blood cells, and for that matter, white blood cells that fight infection. Well, in leukemia, it's also one of those diseases where cells grow out of control. And it was found that for certain types of leukemia, with a certain defect in the DNA, which leads to the leukemia, low folic acid diets actually make it easier to treat and cure leukemia, because the leukemia is being fed by the folic acid. The folic acid is helping the cancer to actually grow. So actually depriving a person with leukemia of the folic acid can actually be helpful even in treating the leukemia. So in summary, folic acid is important. You don't want to get anemic. You don't want to get gray hair. And especially if you're pregnant or considering the possibility of becoming pregnant, it is important to take a reasonable, approximately 400 microgram supplement of folic acid. But if you are not planning on being pregnant, and if you're worried about your cancer risk, take a look at all those vitamins that you're taking every morning, the B complex as well as the multivitamin, and add up the total folic acid component. And if you're taking maybe a little too much in the 800 to 1,000 microgram range, you may potentially be putting yourself at some kind of risk for various types of cancer. And maybe that's one of the vitamins that you want to be more judicious with. So how can Activ Doctors Online help you with folic acid deficiency, or other problems? So first, we have our unique personal health records. We have a smart personal health record system, which allows you to enter all of your medical records, all of your medications, all of your lab results. It allows you to go from doctor to doctor and keep track of your folic acid, and maybe one doctor doesn't have to repeat it because another doctor has already done it. You can also keep track of all of your vitamins, so your doctor can look over them and is able to tell you whether they think you're getting the right amounts of folic acid or any other vitamin. Next, we have our second medical opinions. Using our second medical opinion platform, you're able to get a second opinion from one of our top Activ Doctor specialists from around the country and around the world. So if you do have some question about some of these conditions related to folic acid, other types of cancer, or any other serious medical problem you may be suffering from, you can get one of our second opinions, and we may be able to help you get back on the road to good health. And finally, with our e-consult system, we allow you, if both you and your doctor are a member of Activ Doctors Online, to connect with your doctor virtually. So maybe you want to ask them, am I on the right amount of folic acid for me? that doesn't seem like something that you would want to take a whole afternoon off to maybe go to your doctor, sit in the waiting room, talk to him for 5 minutes as he goes over your vitamins, and go home. Imagine if you could use our system to be put in touch with your doctor virtually in our totally secure HIPAA-compliant system so that you could get your simpler questions answered without actually having to make a trip to the doctor. So with that, I'm going to turn it back over to Tom, who can tell you how we could go about getting you started with Activ Doctors Online.
Well, thank you, Dr. Zahalsky, for another interesting and informative presentation. Here at Activ Doctors Online, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live healthier, safer, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even lives. We hope you've enjoyed today's presentation, and we invite you to start a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. And for more information, to schedule a demo, or if you have any other questions about our service, please feel free to contact Activ Doctors Online using the information on screen. Thank you for watching, and we look forward to seeing you next month for another informative health webinar.